This is a webinar presenting the findings of a survey of professionals for the London Safeguarding Adolescents Steering Group. The steering group was convened in June 2016 to develop shared principles and enhance policy frameworks for safeguarding young people amongst London's key strategic bodies. And there were a series of aims for the group, but one of them was to enhance the group's understanding of the experiences and needs of adolescents through engagement in research and practice evidence. So as part of this work, the contextual safeguarding team at the University of Bedfordshire ran a survey to capture London-based practitioners' opinions on London child protection procedures, and this presents the key findings of the survey. The results will be used to draft a chapter on safeguarding adolescents in the London child protection procedures that will shortly be available for public consultation. We had 120 respondents to the survey, although response rates to individual questions fluctuated between 100 and 120. Of the 106 who provided their job title or their sector, the majority were working in policing, 22%, in health, 22%, or children's social care, 13%. And the rest comprised professionals in safeguarding, education, and other sectors as well. This wasn't a randomised sample, which means we can't generalise from the findings to all professionals in London working with children and adolescents. Instead, it's a self-selecting sample, so we have to be a bit cautious in our interpretations. And of course, it's based solely in London as well. Procedures were perceived to be broadly adequate, with nearly half of the 120 respondents, 48%, somewhat agreeing that the London child protection procedures outline how professionals should respond to adolescents in need of support, and then with a further quarter strongly agreeing. Where there were concerns about London child protection procedures, these related to the procedures not being adolescent-specific enough in terms of threats or needs or processes, behaviours, context of harm, and the role of peers. There was a clear correspondence between professional confidence in procedures and the context of risk facing children and young people. A substantial majority strongly or somewhat agreed that the London child protection procedures adequately address safeguarding adolescents at risk within family environments or institutions. But this confidence dropped as contexts of risk moved further away from the family. On questions relating to contexts of risk beyond the home, more professionals were unsure or ambivalent about the adequacy of the London child protection procedures. And fewer than half strongly or somewhat agreed that the procedures adequately address safeguarding adolescents at risk in key contexts beyond the home, as this slide shows. So just to be clear, for the ease of reporting, we combined strongly agree and somewhat agree as responses. We invited follow-up comments to that question, and those that responded focused on the inadequacy of the procedures in relation to recognising and responding to risk outside the home. So that included difficulties evidencing significant harm faced by peers or online, a lack of congruence between the lives of teenagers and the child protection procedures, a range of attitudinal challenges, maybe where children are seen as responsible for risky choices, and as well challenges in recognising evolving types of harm. We then asked how confident professionals were at identifying adolescents at risk, and the majority of respondents were confident that they could identify harm in all the contexts presented, but in general this confidence decreased as the context of harm moved away further from the home and connection to family. So a significant majority either strongly or somewhat agreed that they were confident they could identify adolescents who have experienced or are at risk of experiencing significant harm caused by parents and carers, 92%, adults within the family, 92%, or adults connected to the family, 89%. And confidence was lowest in identifying adolescents who've experienced or are at risk of experiencing significant harm caused by children and peers unconnected to families offline, 68%, an adult unconnected to the family online, 63%, and children and peers unconnected to families online, 57%. Despite the decline in confidence described above, professionals are still slightly more confident in their own ability to identify risk or harm in all contexts than in the adequacy of the protocols to address harm in those same contexts. And if that's true more widely, it suggests that there are areas where child protection procedures need to be improved almost to catch up with practice. So you can see there that the figures are just slightly lower in terms of confidence in those procedures in those different fields than they are in professional confidence. In every context presented, a majority of respondents were confident that they could respond when an adolescent was at risk of or experiencing serious harm. But again, that confidence diminishes as the source of risk is located beyond the home and family. And I've just pulled out some of those key contexts there to illustrate that contrast. When given the opportunity to say more, those who reflected positively on their own ability to identify and respond to that risk attributed their confidence to experience working on cases of child sexual exploitation, to training they'd received and or access to peer support and professional networks, much like the Contextual Safeguarding Network, which promotes the use of approaches like peer mapping, for example. But where people identified challenges responding to risk faced by children, a series of themes were identified, including adolescents not disclosing risk or harm, at least not necessarily to police or social workers, partly because of the loss of control it represents. And I've put a quote up here that illustrates that. They want support but don't want to lose the little control they do have and want to be recognised as having developed coping strategies and strengths that they might be asked to give up while child protection processes identify them as a child. Alongside that, people identified complexities around responding to peer-on-peer online abuse and variability in kind of approaches from managers in when you would remove a child from harm. We then asked a range of questions that broke down professional confidence in identifying and responding to risk by the age and gender of the young person. Between 92% and 94% of respondents identified that they either strongly or somewhat agreed that they could respond to the risks and factors that negatively affect the safety and well-being of both boys and girls between the ages of 10 and 17. So in general, those are very high levels of confidence professionals are reporting. Within those high levels of confidence, professionals reported being very slightly more confident in responding to risks to girls than boys, and to those aged 13 to 15 over those aged 10 to 12 or 16 to 17. However, as you can see from this graph, the story is really one of confidence being very similar, irregardless of the age or gender. So in general, very high levels of confidence. And those differences between are really very small. Additional text responses to this question highlighted that confidence to identify risk for different age groups might relate to professionals' level of experience with those different groups and or training that they've received. And there were also some comments highlighting the challenge of assessing risk and managing adolescents' choices, adolescents' varying levels of self-awareness about risk as they get older, low rates of disclosure from adolescents, and risks to boys and young men being less frequently identified, in part because boys are more likely to be seen as perpetrators of harm than victims. When asked about their confidence in responding to risk by age and gender, you can see the answers are very similar. Again, we've got very high levels of confidence in responding to risk, regardless of age. Respondents were then given a list of child protection practices and procedures and asked to consider how useful each is to professionals who respond to the safeguarding needs of adolescents. All of these tools were perceived to be useful, with a majority of respondents identifying each tool as either extremely useful or very useful. Almost 3/4, 71%, reported that Section 47 inquiries were either extremely or very useful, while this figure was 67% for child protection conferences and 63% for child protection plans. Although all tools were seen to be useful, early health assessments using the CAF were identified as the least useful tool, with 50% identifying these as either extremely or very useful, and 21% identifying these as either slightly useful or not at all useful. Unfortunately, on this question, respondents weren't given the option of elaborating further on their answers, so we don't have any qualitative data to help make sense of these answers. But given the challenges already identified previously in the survey, we might hypothesise that the use of statutory tools like Section 47 inquiries and child protection procedures is seen as necessary to ensure the effective safeguarding of adolescents for triggering the right response. So what else was perceived to be useful by professionals in London? 70% of the 100 professionals who answered this question could identify other local or organisational processes that helped them respond to the safeguarding needs of adolescents. And then 54 responded to a follow-up question and identified a range of different things. They've been ordered here in terms of how often they were referenced. There's a great deal of variety here, reflecting, I guess, the multiple aspects of a functioning system of child welfare, safeguarding and child protection. We then asked what young people have told professionals works well when there are child protection or safeguarding concerns. And of the 52 who responded to this question, 18 said, young people haven't told me anything, and the remaining 35 provided these answers. And the majority of responses focused on the quality of relationships, the quality of interaction and interpersonal practice rather than on procedures. There were some answers that did say young people value interventions that keep them safe, but largely it was a focus on interpersonal practice. We don't have young people's views themselves, but what is on this slide does strongly echo findings from other research where young people have been consulted about safeguarding. Professionals were then asked what supports young people's engagement, adolescents' engagement in safeguarding and child protection procedures, given that, as one respondent said, once children are 16 and 17, you can only protect them if you can engage them. This is the challenge, and mostly statutory bodies are not set up or resourced to do this. And so we had 77 responses to this question. And the question was, professionals often say it's difficult to engage adolescents in child protection processes, so what can change to support that engagement? 20 responses focused on the way that respectful attitudes to young people are demonstrated in communication, which improves their engagement. They described the value of allowing young people to speak and lead, including in meetings and delivering training. And professionals also highlighted the positive impact of spending time explaining child protection processes, as well as issues around risk and confidentiality in open and straightforward ways that avoid making promises that can't be kept. 12 professionals described the importance of adolescents having access to consistent support from the same people and highlighted the importance of addressing high staff turnover. The creation of trusting relationships was seen to create a positive context for adolescents to disclose the harm they may be experiencing. Other approaches that were highlighted as well included the use of peers and peer mentors in creating child protection plans and undertaking direct work, training on working with adolescents for frontline professionals, including the use of appropriate language and how to work flexibly with teenagers, the use of services that work relationally and that can advocate for and engage adolescents, the need for physical spaces or drop-ins where adolescents can build relationships with professionals and that create good conditions for trust being built and disclosure, and the importance of working with adolescents and responding to their needs. Survey respondents were asked to list the partners they currently work with to safeguard adolescents. They were free to describe these agencies themselves, so that did make it difficult for us to categorise all these answers effectively. But this is how we've done that. And the majority, as you can see, were working with children's social care, safeguarding and multi-agency teams, and then with health, with education, with police and voluntary agencies, and then a range of other agencies as well. And then they were asked, who would you like to work with that maybe you're not currently working with? And although the same agencies did show up here again, there was a greater focus on wanting to work with youth workers and in schools and with mental health professionals, and in particular a focus on more integrated services, so having mental health professionals working in schools, having youth workers working in health or A&E settings. Some people were at pains to make clear in their responses that actually it was commitment to partnership working that was key rather than who was in the room. But as I've said, there does seem to be an appetite for more work with youth workers and mental health professionals. We then asked what changes, if any, to practices and policies would improve professional responses to adolescents' safeguarding needs, and 78 professionals provided answers to that question. There was no real consensus about what aspects of policy or practice needed to change. Instead, we had a wide variety of responses being offered. But there were two maybe clear themes. The first being improved multi-agency working and more resources. So that's clarity on partner roles, shared responsibility for cases, better and more proactive information sharing, and making use of the professional who has the best relationship with the child. And then just more services in general and more resources for people to do direct work with adolescents to address high staff turnover. People highlighted the need for more school nurses and more safe placements as well within that. A range of other responses were also offered, which included the importance of listening to and including young people in case planning, training, assessment and policy development, training about safeguarding adolescents and the thresholds for allocation of support, including training for teachers and school governors, a need to afford adolescents the same right to protection as younger children, but to be clear about adolescent-specific development, risks, behaviour, needs, contexts, and effective responses. Some people raised the issue of a need for improved guidance and protocols in relation to specific risks around, say, gangs or trafficking, drug and alcohol misuse, and how to address a range of different concerns when they are coexisting, as well as improved assessment that considers family, wider context and indicators of both risk and resilience. So what does all this mean? Well, there are a range of implications, but we've just drawn out a few here. Firstly, that professionals need to be at least as confident identifying and addressing risk to adolescents in these wider contexts outside the home as they are within the home and in the family context. That they may need access to more experience working in these contexts, peer support and training if they are going to be confident. That professionals may be identifying risk that they don't feel supported to address by procedures. So that does raise the question of whether the London Child Protection procedures might need to be adapted slightly to improve professionals' confidence in how adequate they are to address risk in these wider contexts. Also that there's appetite for tools and resources and approaches that recognise the distinct dynamics of safeguarding adolescents. Potentially what we've seen here is that statutory procedures are maybe being relied upon to trigger information sharing and appropriate action being taken to safeguard adolescents, rather than some of those early intervention tools. We've seen that there are many familiar challenges that would be raised, I think, by people across the child protection system that relate to information sharing, multi-agency working and high caseloads that prohibit consistent direct work with children and young people. And then a need for improved multi-agency work with schools, CAMS and social care, as well as the possibility for more co-located or accessible services and peer mentors. The survey will be available online for you to look at in more detail, and do look out for the draft chapter that will be included in the child protection procedures and the consultation that you can take part in as well.